Thank you for joining us for this class today. My name is Nurse Jay, and I am from the United States, and I've come to teach two classes, but the first one we're going to do today is called Patient Confidentiality. One of the most important things that you can remember as an employee of EGBE is that we take patient confidentiality very seriously. It's very important that you understand that patients need privacy in order to heal. The way to remember patient confidentiality is this: don't talk about a patient or look up anything about a patient in the medical record unless you have a medical need to know. That means if your neighbor is here at the hospital, you don't talk about your neighbor being at the hospital. You allow them privacy in order to be able to get better. The objectives of this class: we need to define patient confidentiality. We need to define PHI. We need to understand the importance of patient confidentiality, and you will eventually sign an attestation saying that you understand what this means. So, there are two definitions that I have here for patient confidentiality. One refers to the right of the patients to keep their records private, and it represents our obligation as physicians and medical professionals to morally and legally handle patients' information sensitively. The other thing that this means is that patient health information should be protected unless it's fulfilling an essential purpose. An example of this is that if a patient comes into the emergency department and they need to go to the operating theater, and Nurse Eric calls from the operating theater and says, "I need to understand what's going on with this patient," it is okay for the nursing staff in the emergency department to talk to Eric about the patient that he will be receiving in the operating theater. What is top secret and confidential needs to be top secret and confidential. Patient information is private. What happens in my life with my body and my mind is my business. If we are sick and this is the hospital that we come to, we deserve the right to come here and not have everybody in EGBE know what is going on with us to receive care. The types of patient information that we need to keep private are the following: a patient's reason for visit at the hospital, the patient's diagnosis, the medications that the patient is on, their past medical history, their pregnancy status, their HIV status, psychiatric diagnosis and treatment, their family history, their drug and alcohol history, and their smoking history. To give you a few examples, if a patient comes in and it's a young woman and she has been raped, and she is positive for pregnancy, it is nobody's business that she is positive for pregnancy but that patient. If a patient comes in positive for HIV, it is that person's responsibility to tell other people, not our responsibility as healthcare workers. In my family history, if my father had madness, it is nobody else's business to know that my father had madness. And if I was a young person once in my life and I was addicted to drugs, but I have been redeemed by Jesus and I am living the right way, it is nobody's business that I used to be a drug addict, because you can imagine how people will treat others when they find out somebody's history. So that is a patient's private business. PHI stands for Protected Health Information. This means anything and everything in the patient's medical record. So my question to you is this: does Nigeria have laws about patient confidentiality? Yes or no? The answer is yes. The National Healthcare Act of 2014 is the piece of legislation that governs all healthcare in Nigeria. Our rules, how we do things, the regulatory purposes of the hospital all fall under the National Healthcare Act. In Section 29, what I want you to pay attention to is that Dr. Ben Maliki Dogo, who is the Chief Medical Officer of the hospital, has a priority to keep patients' medical records safe. It means that we don't go outside talking about patients. If it is found that we did not keep things secure, our Chief Medical Officer could be imprisoned and fined 250,000 naira per offense. The Freedom of Information Act of 2015 says that professional communication between patients and healthcare workers is privileged. What this means, an example, is that if I come into the hospital and I am being abused and I am being beaten, and my husband calls the next day demanding to know what I said, you cannot tell the husband what I told you as the healthcare provider. It is confidential and private. To get into a couple case studies, the first one we have is surrounding social media. Lots of people have Facebook, Instagram, TikTok. Take your pick of whatever social media platform that you use. A nurse posted the following: "Can this shift be any longer? It started out with a waiting room full of nagging people that don't really understand what an emergency is. Then I had to deal with the drama of transferring a 400-pound, no joke, intubated COPD patient down the hall to the ICU. Those ICU nurses are such divas, and I was not in the mood for their whining. Anyone around ABC Hospital want to save me with a drink and get me through the next 10 hours of my shift?" What is wrong with this picture? Can you identify who the patient is? The answer is yes. At ABC Hospital, 400 pounds, COPD, intubated, and in the ICU. There are 5 pieces of information that directly identify that patient. Their privacy has been compromised. The second one is the use of pictures. A nurse educator from the Tropical Disease Clinic is creating a professional poster for a conference. She includes many pictures of patients on the poster. What do you think she needs to consider? You are correct if you say that she needs to consider getting consent from the patient to use their picture. The third case study is as follows. While working the shift overnight, Nurse John's grandfather was admitted to the hospital. John cannot get in touch with his grandmother. He's very worried at this point. So while charting his last assessment, he decides to go into the record of his grandfather and find out what is going on. What do you think is wrong with this? First, John is not the nurse for his grandfather, so he should not be going in the chart of a patient that he is not taking care of. Number two, he went into the chart of his family member and did it during working hours. All of these things are wrong. What he should do is finish his shift and then go speak with the doctor of the grandfather while the grandmother is there. Many of you will look at this picture and know exactly who this person is. Moses Bliss. So while on duty at the gate, you're a security guard and you see somebody pull up to security. Moses Bliss is sitting in the back seat, holding his abdomen in severe pain. You allow them through the gate and immediately call to your other security guards on the walkie-talkie that they will not believe what's happening because Moses Bliss is at the hospital and he is going to the emergency room. But just when you say this in the walkie-talkie, other patients are walking in and they hear it. What do you think is wrong with this? Don't we think that Moses Bliss deserves just as much privacy? We don't want him to leave the hospital and be surrounded by a crowd. If you're an attendant working at the hospital, and while you are cleaning, you walk by the room of your neighbor 2 houses down from you, and you see them in there. So you decide to stop and say, "What are you doing here?" What do you think is wrong with this picture? Your neighbor came to the hospital to get help, not to tell you why they are here at the hospital. We need to allow them their privacy. What you should say is, "God bless you, hello," and you keep walking. Our last case study is this. If I'm an auditor and I was working and totaling a patient's bill, you notice that they currently have a balance from another visit. You think that this is horrible. When you get home that night, you tell your spouse, "Can you believe that Mr. Tanubu is so careless and cannot pay his bills?" What is wrong with this? First, you made a judgment about Mr. Tanubu when you don't know what's going on in his life. And number two, you went home and you told your husband about it, or you told your wife. Both of those things are wrong. In closing, what I want you to remember about patient confidentiality is that treat others how you want to be treated. If you do not want your business spread all over town, then keep your business to yourself. As employees of Equa Egby, it is priority that we allow patients that privacy. Thank you for watching.